Well, thanks everybody so much for coming here this morning to hear about an exciting new announcement for the city. The work of making our streets safer certainly is a community challenge that requires a community response, and we all know that. And everybody has a role to play in this. LMPD, citizens, Office for Safe and Healthy Neighborhoods, Metro government, everybody involved in the process of law enforcement and justice, and that includes our outstanding Metro Department of Corrections. Under the leadership of Director Mark Bolton, this good-looking gentleman right here, in 2015, Louisville Metro Corrections met the rigorous core standards criteria established by the American Corrections Association to become an accredited facility, and we've bragged on them many times since then and before then. Corrections has a tremendously difficult job that they do with dignity and a tremendous work ethic, a tremendously clean facility, a model of effectiveness, discipline, efficiency, teamwork, and compassion as well. And we've realized that through our citizens' interaction with the corrections system, these are challenges and also opportunities to get them the help that they need, particularly when it comes to battling one of the drivers that we see of so much of the crime in our city, especially violent crime in our city, and I'm talking about drug addiction. The high volume of addicts we're seeing committing crimes and then winding up in our system has led to Metro Corrections becoming one of the area's largest mental health and substance abuse treatment and detox facilities. The jail, in effect, is the largest detox facility in the state. There are approximately 100 people arrested and booked in the jail each day, and many of them are dealing with these kind of challenges. Because once addiction takes hold, many people can only beat it with a lot of help. Many of them realize when they're arrested that they're at the lowest point of their lives, and they want a way out, they want a way up, they want some help. That's why I convened the dual diagnosis cross-functional team in January of 2013. It brought together for the first time representatives from criminal justice with community service providers. They worked together, sharing data and information to better understand how we can better address the needs of this population that has both mental illness and drug and or alcohol addiction. Now, through Metro Corrections, we offer programs like Familiar Faces, Action, and Community Treatment, or acronym FACT, and Enough is Enough, a fantastic program to help the citizens who come through corrections get the help and support they need to make better lives for themselves when they are released. So today, we're here to announce a new tool in our toolbox to fight crime and addiction and help more of our citizens stay off of drugs and out of jail. I'd like to ask Tony Zipple, President and CEO of 7 County Services, which is the champion for this program called Second Chance, to fill us in on the details. Tony.
Thank you, Mayor. And thank you for making this announcement today. You know, on days like this, I really feel lucky to live in Louisville. I've had the opportunity to be in a number of places, and there are not many cities that has a mayor, a director of corrections, a chief of police who understand and care about this issue the way that our leaders in Louisville care about it. We really are lucky today to have them working to make this a better community for all of us to live in. This location that you're in right now, here on Magazine Street, houses our largest operating unit in our Adult Services Division, and there are a wide range of programs here, hundreds of people a day who move through here, getting a very wide range of services, the kinds of supports that our friends and neighbors and coworkers and relatives who have serious mental illnesses and addictions need in order to do well. It's also our closest location to the jail, and it's going to serve as our point of entry for the Second Chance Grant. Now, the Second Chance Grant integrates the correction system with long-term community services, and it aims at providing people with a second chance at rehabilitation, a chance to break the cycle of being on the street, being in the emergency room or the hospital, being in jail, and starting it all over again. We know that intensive integrated services for addictions and mental health services work, and that they help people to get back on their feet, moving in the right direction, and can simultaneously reduce costs by reducing time in the jail, arrests, time in the courts, time in the hospital, can improve public safety, and can do the right thing, can make this community a more compassionate place for all of us. That's a threefer that you don't often get in this world. With this program, we will start a relationship with the offender prior to them even leaving the jail. And we're going to meet them literally at the jail door to make sure that as they walk out, they've got a friendly face that they know to come to, that they have people that will help them with the kinds of things that you and I take for granted, but that make life for us manageable. A decent, safe, and affordable place to put our heads at night, opportunities for a job, friends and family. We'll be at the door of the jail to greet people and help them get connected to these kinds of things. And there's an enormous amount of research nationally that says if we help people who have struggles with addictions and mental illness with these kinds of basics, we reduce reoffense, rearrest, reincarceration. This is what it takes to help people recover. And in addition to those services, we're going to provide a wide range of specialized clinical services as well to help people stay straight and sober and sane so that they can enjoy decent, safe, affordable places to live, and a job, and friends and family. These kinds of things in combination, provided in an assertive way when and where people need them on a 24/7 basis, is what Second Chance is all about and what this grant gives us the capacity to do. This grant will even provide for peer support and peer services, people who have struggled with addictions or mental illness themselves, many of whom have been guests of the county jail, but have recovered and are doing well and can serve as educators and role models for folks coming out of the jail now to let them know that it's possible to have a better life. And as I said, all of these services available on a 24/7 basis. We already have the foundations for this program in place. We already work closely with the courts in the jail. We already have intensive mental health services, many of whom which are offered out of this building, like assertive community treatment. And we already have deep expertise in the area of addictions in doing things like recovery-oriented medication-assisted treatment for opiate addictions. Second Chance gives us an opportunity to integrate and bring all of these services together and to take them to the next level. So we're really excited to be here today as a partner in the Second Chance program. We're excited to be partnering with leaders in this community. 7 Counties is a community mental health center. We're all about building better community, a better place for all of us to live. And Second Chance is one of those really remarkable building blocks that lets us help to do that for this really wonderful community. With that, I want to turn it over to Director Bolton.
Good morning. I really appreciate the opportunity to be here this morning. Appreciate you all coming. We've come a long way to get to where we've gotten to today. You know, we've been talking about this issue for a long time. Before I really get into it, I would like to really thank the mayor for recognizing this challenge with the formation of the dual diagnosis cross-functional work group, Kim Allen and her team with the Crime Commission, and certainly our colleagues and partners at 7 Counties. In 2015, we booked over 32,000 people came through the Sally Port at Metro Corrections. You know, that's the size of a medium-sized city coming through our Sally Port every year. And many of these individuals suffer from co-occurring disorder, mental illness, substance abuse issues. It's no secret the opioid problem that we have in this community and that we are dealing with, that we are struggling with on a daily basis. In 2015, we had over 7,500 admissions that we were actively had to detox, and the majority of those detoxes were opiate related. This year, we are tracking to detox over 10,000 people in calendar year 2016. Most of those, or a high percentage of those, are co-occurring, and a high percentage of those are opiate-related detox. Over 25%. We are the largest detox program in the region, but we're also the largest mental health facility in the region. On any given day, we are actively housing 2,000 plus inmates. About 25% of them have an identifiable mental illness that requires medication. Those mental illnesses range from schizophrenia to major depression, bipolar disorder, and many of them are or need to be on medication to assist them with managing that diagnosed mental illness. Another 25% have a mental illness that has not been diagnosed or currently treated, or which might be persistent but not categorized as a serious mental illness. This is the group of people that we are focusing on with the Second Chance program. We feel that the success of this initiative will really focus on managing individuals that have mental illness, addiction challenges, but more importantly, will assist them in services that we're currently not able to provide, specifically stable housing, advanced vocational training, and educational services, all designed to impact criminogenic thinking. The success of this initiative will lessen the return of these offenders to jail and thereby lessen the burden on taxpayers and on Metro Corrections staff who have been charged with the difficult management of these offenders and the challenging behaviors they often exhibit. Individuals that, we have about a $57 million budget. That's what it takes annually to operate Metro Corrections. Individuals that we are targeting with this program require the most expensive bed in the jail system. Our average bed cost is about $70 per day. But when we cost center these individuals with mental illness, individuals that we are actively having to detox, those individuals have to go onto our medical floor, and cost centering those beds are about $236 per day. So if we can keep these individuals in the community for longer periods of time, or when they do come back, because they are going to come back on occasion, their levels of acuity are not as high, or they can stay out longer, everybody wins. The success of this initiative will add strength to our community and our community muscle by stabilizing a group of adults with mental illness and substance abuse disorders whose otherwise are underserved, often resulting in a revolving door cycle in and out of the local criminal justice system. We look forward to strengthening our partnership with 7 counties and to being able to, we're going to be collecting a lot of data on this program because we want to be able to show everybody that it's working. And we're going to be able to do that, I think, with this program, with our relationships and with our collaboration and through the collection of data. We look forward to the success of this program and bringing this to our community, to what has been historically an underserved population. Thank you.
Great job. Kim Allen, I want to thank you for some of your early leadership and ongoing leadership with this effort. Would you like to say anything here today?
I would echo your remarks. I think this is another tool, another important piece in our continuum of services that we're building.
And what you're seeing is we just needed to pull all the people together that were touching these inmates and patients in the community that historically have not spoken with each other before, for us to get to an announcement like today. For a taxpayer, what they see is not just more humane and compassionate treatment of people that are battling addiction, but we also see a reduction in cost of handling the prisoners from $75,000 to about $25,000 on an annual basis. So it's wonderful for efficient use of taxpayers, but more importantly, it's wonderful in terms of how we treat our brothers and sisters here in our community as well. So it's a win on many, many different fronts here. So with that, I'm happy to take any questions.
Do you see this as one aspect or one key to perhaps reducing the overcrowding issues in the jail?
Yeah, and I want to brag on Metro Corrections. Eric is here, Steve Durham, Mark. These guys have been our leaders with our Louis Stat program, use of data and where data shows us we can improve. So one of the things that they brought to the table early on in our administration was the frequent faces that are really giving us the a large use of the jail. Our number one frequent face, our familiar face, was arrested 150 times in 5 years, I believe, right? A few more than that. Few more, okay. Well, and so the question was why? All of our frequent faces suffer from mental illness and some form of substance addiction. So as we can then reduce that population through more humane treatment, we obviously free up beds in the jail and we reduce the cost of corrections at the same time. So we're optimistic, and as you know, right now we're bumping around our max right now. So when you talk about 100 people, it's very material for us. It's not going to happen overnight, but it's a tool for us.
So the 80 people that you'll be able to serve who have mental illness and substance abuse disorder over the next few years, what percentage is that of the total amount of people that you're seeing with both of those coming through?
A lot of people.
Yeah, that's, it's a little bit more complex than that, because when you talk about those 80 people and you talk about the impact of those 80 people on the system, and the mayor alluded to that with, when we look at our high system utilizers, and those are the people that are basically residing in jail on the installment plan, literally. You take our number one familiar face, the guy that the mayor talked about. He's literally lived the last 5 of his last 7 years in the jail. So he has consumed a lot of resources and a lot of bed days. So when you talk about this group of individuals that we plan on serving, the bed day consumption of that group of people, if we can reduce that by half, the impact is going to be significant. And also the compelling part of that is these individuals that when they are in custody, they're taking a lot of resources, they're taking a lot of time, they're taking a lot of energy, they're involved in a lot of use of force issues, a lot of inmate on inmate assaults, inmate on staff assaults. So if we can see a reduction in bed day consumption, if we can see a reduction in use of force because they're no longer going to be we're going to see that bed day reduction. We're going to see a reduction of medical costs, mental health costs, prescription drug costs, and a much higher return on the investment by keeping individuals in the community. So yeah, I think it's going to be very impactful, absolutely.
If I could just add, all the things that Mark said are exactly right, and there's an analog for it in all of the other systems in this community. These are folks who are spending lots of time visiting the emergency room. It costs $1,000 to walk in the door of an emergency room. It costs $650 or more to get an ambulance ride to the emergency room. Hospital time is anywhere from $700 to $1,500 a day. And this group of people, in addition to spending lots of time in the jail on the installment plan, are also familiar faces in the emergency room and in the hospitals. They're familiar to the homeless shelters. There's all kinds of collateral advantage to this in the community, and all of this saves money. All of this helps to get people's lives back together. All of it makes this community a better place.
How will that money be used? Primarily for staffing or what? The $600,000.
Yeah, most of it is staffing. In the business that we're in, the large majority of the dollars are staffing dollars, and that's where this goes. It goes into hours of skilled time that can do the outreach and engagement and support that's necessary to help people get along.
How many people are you looking at bringing on for this?
How many people are we? What's the total number, Kim? 5 people.
Can you give us just a quick For example, how will you approach someone who is in need of these services, and kind of walk us through the process?
Sure. You know, we want to build a relationship with people when they're in the jail to the extent that we can do that. So we work closely with the jail staff, and they help to identify people that are at risk of returning if something different doesn't happen. Our staff will go into the jail. We actually have an office at this point in the jail, and our staff are in the jail virtually every day. Our staff will begin building relationships with this person, helping them to understand that there's a better way to do things and that they have opportunities as they leave. As I said, we meet them at the door. We make sure that on the day that they walk out of jail, they've got a place to stay that night, because we don't want them just drifting around on the street, and that greatly increases the risk of them getting into some kind of trouble that lands them in the emergency room or lands them back in jail. So we'll be there to meet them. We'll make sure they have a place to stay that night. We'll meet them for breakfast the next day and start working with them on how do you get your life together in the community, a decent place to live. Do you want to work? We'll help you with jobs. We'll get you connected to the mental health and addictions treatment services that are available at locations like this one that we're in, so you can get the care and medical support that you need. And we'll stay with people and see them multiple times a week. We've got the capacity in these kinds of programs to have as many as 15 or 20 contacts with a person over the course of the week. The mission for our staff is to do whatever it takes to help people stay stable in the community and avoid the emergency room, avoid offense, avoid arrest and incarceration. So staff are around doing all kinds of things on a 24/7 basis designed to help people do okay. The staff is a mix of clinical staff, licensed clinical professional staff, and it includes peer specialists, as I mentioned earlier, who've had the lived experience of mental illness and addictions.
Are there any other cities who have gotten grant money like this and started second chance programs? And is there enough data to kind of gauge the success of those programs?
Yeah, there are quite a few cities that are taking advantage of second chance funding. A lot of our peer cities, I know that Indianapolis and Seattle, where I hail from, are taking advantage of these types of programs. So there is a marker in terms of seeing what's going on in other places. We're really interested in Seattle LEAD, for example, which is law enforcement assisted diversion in harm reduction type programs, which I think this program will have a harm reduction component to it as well. So we're not necessarily reinventing the wheel, but I think what we are doing is we are taking parts of what's worked in other places and combining them here. And I think the beauty of what we have in Louisville is that we have people that have been working together for a long time, that are all working together and not against the grain, but with the grain to bring resources to the table and make it work. I mean, having an office in the jail for 7 counties, giving them access to our database, for example, giving them access to electronic health records, ensuring that individuals that are part of this program, when they get released back to the street, that there's a warm handoff for housing, that they have a supply of medication, that they're enrolled in health insurance and Medicaid. Those are all components of this program with very aggressive case management systems that I think, this is a no-brainer. In the end game, the ROI on this, the return on the investment, I think is just going to be incredible, and it's the right thing to do.
All right, Rashaad Abdur-Rahman is going to just have a couple closing remarks for us.
Thank you, Mayor. Just one of the things I wanted to share is that as we talk about substance abuse and overdose prevention, and we look at some of those harm reduction models that we're describing, it's going to be really important to elevate and broaden that notion for some of the other forms of violence that we're seeing in the city. So when we talk about suicide prevention, certainly we're looking at moving forward some zero suicide initiatives in partnership with Humana. But as well, when we think about gun violence and homicide in the city, when we think about the kind of harm reduction and how this is all sort of part of a public health issue is going to be really critical. The mayor was just talking to a group of youth yesterday who were sharing some of the concerns they had for their friends, who were sharing some of the fears they had, who who are talking about how the trauma of some of the environments that they live in have affected them, both in school or in home in their neighborhoods. And so as we think about trauma and how that can impede and affect behavior and how that really plays out in some of the dynamics that we see in the city, really thinking about how we move upstream, how we use harm reduction models, how we use evidence-based practices that are going to really reach youth and impact some of what we're seeing in terms of violence as well. So I'm super supportive of us thinking upstream and thinking about how we use our resources smarter and more effectively, and really applying that broadly as we talk about some of the violence that we're seeing in our city on a regular basis.
So, Rashaad, you're saying that this could have a ripple effect to the point that it'll affect the violence we're seeing on the streets? Is that what you're saying?
I certainly think all these things are connected, particularly when you talk about substance abuse and when you're talking about co-occurring diagnoses and disorders and how that tends to populate in high-risk areas. I think it's certainly going to have an impact on what we see in terms of family structure, neighborhood structure, and some of the stability that needs to happen. We have to do this comprehensively. We have to understand that substance abuse is prevalent in many of the dynamics that we talk about, and that addressing that is going to be part of how we see reductions happening in other areas as well.
Okay. Well, as y'all can see, this has been a long time coming. This is a great day for our community. Really acknowledgement of a lot of hard work by a lot of good folks so that we can help more folks in our community. Thanks for coming out.